Wednesday. Thank you for tuning in for today's video. Today I wanted to talk all about stretch marks. What is the anatomy of a stretch mark? Please feel free to ask questions in the comments. I'll be happy to answer them. This is one of my favorite topics when it comes to microneedling or radio frequency microneedling. So, what is a stretch mark? Oftentimes you'll hear stretch marks often called striae. Just keep in mind, these are the same things. And stretch marks occur at the dermal layer of the skin. The dermis is very resistant, and it actually allows your skin to stretch. However, you can, of course, get stretch marks left over. And stretch marks typically most often appear on areas that have more fat. So it can be the abdomen, the breasts, the buttocks, the thighs, the hips, and things like that. Stretch marks can often be associated with excess weight gain. So any period, of course, we know pregnancy is a huge one, and typically it can happen in the last trimester of pregnancy. These stretch marks can happen, very quickly, but also during growth spurts for teenagers or even people in their early 20s, or anytime you do gain weight. Some people can be more prone to stretch marks than others, so also keep that in mind. I will kind of go over that as well. So with stretch marks, they can appear anywhere on the scale from purple to white. You have all shades: purple, red, pink hues, and often they will come up with almost like a shiny, shimmery look on the skin and almost have a bit of a divot there in the skin as well. Stretch marks can sometimes cause an itching or burning sensation, but not always. Usually they can cause emotional distress, but they're nothing to worry about as far as a medical issue or anything like that. And there are treatments you can seek through a dermatologist or med spa or plastic surgeon for your stretch marks, which I will go over as well in this video. I am going to go over just a couple skincare products. With stretch marks, there isn't really something that's going to help take your stretch marks away. It will definitely help if you can keep them hydrated as they occur, and the hydration will also help diminish some of the itch or things like this that can happen with the stretch marks. For those products, I'm going to recommend our cellular renewal serum here. And I'm also going to recommend the Revita Peptide Moisture Cream if you want to do a massage. The massage can also help, just kind of help with blood flow and things like that as the stretch marks are occurring. The statistic is that about 50 to 90% of pregnant women develop stretch marks while pregnant. Of course, women are more prone to stretch marks for this reason, but men can also get stretch marks as well. It can happen on the abdomen for men. If men are weightlifters, I've seen them happen at the axilla areas. So this is also something that can definitely happen. I see some questions coming in. Hi, Alex. Are there any lifestyle factors that can influence the likelihood of developing stretch marks? So yes and no. A big part of stretch marks is going to be a genetic factor. Weight gain, again, is going to be big. So if you have a lifestyle where you're not eating well and you're gaining a lot of weight, yes, you will be more prone to developing stretch marks. People that have more cortisol can be more prone to stretch marks as well. And it's important that you eat, a whole foods diet. You do want to get all of your vitamins in your diet. So that will be vitamin C, zinc, collagen, vitamin E. You want your skin to have that really good elasticity, and that can also help as far as like preventing being more prone to stretch marks. Of course, when pregnant, you also do want to stay really hydrated. Limiting caffeine will also help and can help prevent stretch marks. But, it's not something always you can control how much weight you're going to gain in that last trimester. So these are, things that can definitely happen. But as far as basic lifestyle, diet, getting enough sleep. These are things that can help. This is that link for those products, guys. You can use the code there, stretch marks, on our retail store. And this will save you 10% in the next 48 hours if you want to do some shopping for cellular renewal or Revita peptide cream. That you can also use Retin-A on stretch marks once approved by your dermatologist. This is not something you want to use while pregnant or breastfeeding. So again, you do want to get approval, and it is a prescription. You can also use MDPen's retinol 1%. This can also, somewhat help. This has ceramides in it too, which will also help keep those stretch marks nice and hydrated, which you also want. So just another product to think about. Again, you don't want to use tretinoin, Retin-A, retinol, no vitamin A's while pregnant or breastfeeding. I see a new question. Hi, Alex. What are the key differences between fresh and older stretch marks? And do the treatment approaches differ at each stage? So yeah, let's talk about treatment. Typically, when stretch marks come up, again, they can be of a darker shade, and then they will diminish into hopefully something that is more it will match your skin tone or more of a white shade. But again, they can have that glossy, iridescent look to them. So with treating stretch marks, yes, you can use regular microneedling with MDPen. You can also use the ND Med system, which is going to have your RF microneedling and radio frequency. And also fractional skin resurfacing can be used in the case of stretch marks. Keep in mind that stretch marks fall into like a scarring category, so you do treat them somewhat similar to scars. I highly recommend going through MDPen's training program if you are looking to do a lot of body treatments, treat a lot of stretch marks. We have a wonderful program. You can have live models when our trainer comes and really get your hands on with treating all types of scars, including stretch marks. I want to share with you these hand pieces. If you choose to go the radio frequency route when treating stretch marks, the two hand pieces, the middle hand piece is going to be your intensive for RF microneedling, and your hand piece there on the left is going to be the FSR, fractional skin resurfacing. And depending on what your provider wants, you can use one or the other in different situations. And there also is a protocol for using both. This is a very advanced technique, and again, something that you're going to want training for. If you're interested in this device or system, definitely reach out to us at MDPen. You can go straight to our website, mdpen.co, and enter the chat or schedule straight through our schedule link to talk to an MDPen professional about this system. Awesome, guys. So with stretch marks, it is a series. And again, you are falling in that scarring category. So this can be more than 3 to 4 treatments done at a month apart. It's going to really depend on the severity of the stretch marks and, what you're capable of treating. Of course, not a rule, but the sooner you can treat them, the better as they start to come up. But there's definitely things you can do to give some relief if you are getting the itching or the burning or any of those symptoms. And it can be hard for young people that are going through growth spurts as well. So that's also something to keep in mind. I don't see any more questions coming in through the chat. I'm just double checking here, guys. Also, if you've had surgery where you've stretched the skin, such as a breast augmentation, this can also make you more prone to stretch marks. So you can definitely talk to your plastic surgeon or dermatologist about things you can do preventatively. There are certain genetic disorders as well, like Cushing's syndrome and Marfan syndrome, that can also make you more prone to stretch marks and this actual tearing of the dermis. I hope you guys have found this video helpful. I could talk about stretch marks for a really long time. We'll have some live treatments coming up later this month where we will be treating stretch marks. If that's something that you're interested in seeing, definitely make sure that you're following all of our social channels and keep paying attention to our schedule on our website. Thank you, LinkedIn. There's that code for today. And definitely look out for some specials we have coming up for Father's Day on the 18th. Bye, guys.